Hi, this is Tracy Koch, and I'm here talking about an introduction to community assessment. This is from Chapter 4 of your textbook, Public Health Science and Nursing Practice, Caring for Populations. All right, so community health assessment is a strategic plan to improve a community's health. You do the assessment by collecting, analyzing, and using the data. The community health assessment helps to educate and mobilize the population by using the above data. It helps one to develop priorities for the community, secure resources, and develop an action plan. I think it's easier to think about the community as you would an individual. Just as we assess a patient, we can assess the condition of the community. Let's review the definition of community. It's a group of individuals who share a common denominator. So whether it's a geographical boundary, demographics, urban or rural, socioeconomics, cultural and racial similarities, individuals within the community recognize their membership of such community. The purpose of a community health assessment is to gather information and identify those areas that need improvement. By doing this, we identify the areas of need within the community, and that's our first step of health planning, and finding that baseline data to help us figure out what needs are there, what gaps exist, and what we can do to help improve the health of the community. Things that are needed in order to conduct a community health assessment would be health indicators, appropriate data collection methods, evaluation of that data, identification of gaps in data, interpretation of such data, and the use of the data to develop plans. When looking at the health of the community, generally we think about three characteristics: the structure, the competence, and the health status overall. How does community function effectively? Well, here are some ways that one can determine the overall function of the identified community. So looking at the select measures of the community competence, commitment to the community, conflict containment and accommodation, participant interaction, decision-making, management of the relationships with society, participation or use of local services, self or other awareness, and effective communication. So those are some ways we can determine effectiveness of community functioning. The national level promotion of community health. So the Centers for Disease Control promotes healthy communities, and they actually have a Healthy Communities program. This is something you could look up online, and they give a really good layout of community assessments and data collection. So engaging communities in preventing non-communicable diseases, and they promote collaboration between the communities and national resources. So the CDC's webpage is a really good place to start to kind of give you an overview of the basic concepts of community assessment. Components of a community assessment include biostatistics such as morbidity, mortality, and other indicators of health, the overall structure of the community, which consists of the demographics and maybe the cultural makeup of the community, services and resources available, and the overall environment of the community. So there are different kinds of community assessments. So as you identify your community for your project and you begin that process, it might be easier for you to determine how your assessment will be conducted and what kind of assessment you'll actually do. I would say, however, that the Rapids Needs Assessment is unlikely to fit any of the categories for our 442 class. So the kinds of assessments are comprehensive, population-focused, establishing setting-specific assessments, problem or health issue-based assessment, health impact assessments, and rapid needs assessment. So we'll go through each one of these briefly. A comprehensive assessment is a collection of data about populations living in a community. You look at assets, unmet needs, opportunities for improvement, use of community. You'll use community statistics such as the health status, health needs, and epidemiological studies that might already exist. The mandate for conducting such comprehensive assessments came back from in 1988 from the IOM, and we also use them for the Affordable Care Act. Nonprofit hospitals must do community assessments on a regular basis. I'm not sure how often they have to do that, whether it's 2 or 3 years. A population-focused assessment is when you look at a larger group or aggregate. The members may or may not interact with one another. They share at least one similar characteristic or issue, and it can focus on a specific age group, gender, or specific health issue. So it's more just based on that specific population. Setting specific assessments must have a clear understanding of purpose. It's looking at the strengths and weaknesses of an organization or their policies or their programs. You identify indicators specific to the setting and treats the setting as the community. So it's the people within that specific setting and the data specific to that setting. So an example of this would be like an industrial assessment or an assessment of a school. A problem or health issue assessment will focus on the specific problem or health issue. You analyze data that determines who's at risk and promote an understanding of policy, practice, and environment, and who is at risk for having this health problem. So if we look at the problem of obesity and do a health assessment on that, or a issue assessment rather, you're focusing on anybody who is either at risk for that problem or who has that problem. Health impact assessments provide advice to community on optimizing its health by identifying the potential effects on the health of the population and the distribution of those effects within the population. Combination of policies and method are used to judge the programs and projects, and is associated more with environment and social influences on populations. So there are the specific steps used to do a health impact assessment, and those are listed in the textbook in Chapter 4 if you are interested in looking at that further for your population or your choice of projects. A rapid needs assessment is they were first used in the 1960s to assess for immunization coverage and morbidity from like diarrheal and respiratory diseases, and looking at service coverage. It's effective use of limited resources and generally involves like a straightforward data collection, and usually during some sort of crisis. So it's a rapid survey, and the resources are limited, so you really have to kind of hone in on real specific objectives and carry out interventions in a pretty consistent and concise way. So here's an example of supplying fresh water after an earthquake, and I want to say this was in Haiti. The concepts of community assessments are more a needs versus asset assessment. It's community-based participation research initiative, maximizing on the strengths of that community, asset mapping, so people, places, and systems, focusing on effectiveness and not deficiencies. It empowers people and encourages working together and relying on one another and using everyone's talents. Community assessments, community-based participatory research, is an engagement of community members as full partners in an assessment. So the interest, knowledge, and expertise of each individual is used for a collaborative relationship, and this is how they achieve change. The benefits of doing it this way is that it's equal contribution, co-learning, balance between the research and the action, culturally competent care in a community, and it really engages the community in the process of change. So assessment models and frameworks, they provide and kind of guide the community assessment. There's a couple of different ones: the Community Health Assessment and Group Evaluation Model or Change Model. This helps communities build action plans based on assets, areas of improvement, provides program evaluation in communities for diagnosis and an action plan. Here are the steps in a change model. Assemble the community, develop a team, review the community sectors, gather data from each sector, review data, and reach a consensus, enter data, analyze data, build an action plan, and then using the change sectors for the community at large, community institutions, healthcare, schools, or work sites. So it's a pretty versatile overall model and can be used in a lot of different settings. The National Association of County and City Health Officials, this is a planning tool for community health. It's made up of the CDC and the Public Health Practice Program Office. These folks developed a model, and that's the one that we utilize in our community assessment project for this class. It's the MAP model, or Mobilizing for Action Through Planning and Partnership. And these are the 6 phases that you can see are pretty similar to what we just went over in the change model as well. So students, when designing projects, will use these 6 phases, or 6 steps, if you will, but they're very similar to the change model. We've just used the MAP model. Personally, I think it's a little bit easier to comprehend. So there's 6 phases: organizing the vision, performing your assessments, identifying your strategic issues, formulating goals and strategies, and then of course your action. Primary community assessment is when you're actually collecting the data. So we are going to use a windshield survey, and a windshield survey is just what it sounds like. You drive through the community. This is your primary impression, your first impression, and this kind of gives you the overall pulse of the community. You could also do a shoe leather survey, which is walking, but it's the same concept, gathering data from your presence and walking through the community and just looking at what is there, what exists, what the traffic's like, etc. Secondary community health data would be census material or census data, things that you pick up when maybe getting online and looking a little bit further into the statistics and demographics of your community. So here's an example of the windshield survey that we actually have included in our course and for the project, and that is found on the Blackboard page. But you can see is it asks specific questions about the makeup of the community. Now, I'd like to say a word about this. There are 2 kinds of windshield surveys. There's a geographic windshield survey and a non-geographic windshield survey. Geographic windshield surveys are what you're going to use if you're doing your assessment on an actual community, so an actual town or city or a village. That is the kind of survey that you're going to use. If you're looking at a specific group, you're going to use the non-geographic windshield survey, and that's pretty self-explanatory. It also asks specific questions and looks at specific data that you'll gather about that population. These are just some graphs of collecting data and comparing, from one small town to what is in the U.S. So these are different ways to present your data and different graphics that you can use when showing the results of your data that you've collected on your community. Occasionally we have gaps that occur in our data when we're collecting for an assessment. You can use a quantitative survey and define your sample, specific population, and get your data that way. Items in a survey can be open-ended or close-ended. You can do a telephone survey, a face-to-face, or a computer survey. Evidence-based tools that are available to you will compare a community sample with national benchmarks. So this is the part of the project that oftentimes students have a little bit of difficulty with. But when you identify something in the community that you think needs addressed, you do a literature search and look for publications and evidence-based tools or evidence-based literature that is out there to support what intervention you would like to design for your community. So that's a piece of the project that sometimes gives students a little bit of grief, but it really is necessary to give credibility to your interventions or what you've identified that you would like to address for your community. Qualitative data, methods such as focus groups, open-ended questions and interviews. You look for themes or patterns, you develop your action plan, and then evaluate the process that you've used to get your data. The community assessment project for our class is a group or individual project. You can do a video, a formal scholarly paper, a PowerPoint, an infographic, however you want to present your data. You collect your data from your identified community through a windshield survey and a map survey, and then you plan for an implementation and your evaluation. For this online course, the community assessment projects are only presented to the faculty on the Blackboard course page. We don't have students go back to the community and present what they've collected or what they've developed into an intervention or plan, only because everyone's kind of scattered all over, and it would make it kind of difficult to implement that. And when you administer surveys and collect data from folks, that's going to be reproduced and presented in a public fashion. We have to have specific IRB approval and consent forms. So because of our class sizes and because of our online format and our geographical challenge that we don't all live in the same place, we've decided to only have students share with the faculty, and that's how we get around having the IRB submission for each student. So if you have questions about that, you can either email me or call me, because it does sound kind of confusing as I'm talking about it, but we keep it simple, and in your project you are going to design interventions and you're going to talk about how you would evaluate it, but you're not actually going to carry out your plan. This is the evaluation criteria for our project, and this is also in the it's also included on our Blackboard page for the course. It's in the documents under the community assessment, but this gives you kind of an idea of how the points are spread out through the project and how we do the grading. These last few slides are clicker checks, which is included with the PowerPoint that's provided by the textbook. But it's a good review nonetheless. A community health assessment is a process of collecting, analyzing, and using data to help a community strive towards better health. B, it's a one-time strategic plan developed for a healthier community. C, inviting numerous resources into a community so that they will be available for people who want to use them. Or D, charging the city with developing different action plans determined by their committee to help with improving the health of a community. Well, I think you all know the answer is A. It's an ongoing plan of collecting, analyzing, and using the data to determine what policies should be prioritized to improve the health of the community. These priorities change as the community changes. Here's another one. I'll let you read through that. And the windshield survey is the pulse of the community. So this is your primary collection tool, sort of your first glance at the community, if you will, in collecting your data. Well, this is the end of our presentation, and certainly if you have questions, I would encourage you to contact your faculty person for 442. So if that's me, great, or if it's one of the other instructors, please get in touch with us if you have questions about your project. My advice would be to you to start early in the semester looking at this and identifying your community early on. If you're working in a group, it's a good time to set up that relationship and figure out kind of the division of labor and what tasks are going to be assigned to each person in the group. Thanks for your attention, and enjoy the rest of your day.